the Spinal Truth Show weekly podcast edition. I'm your host, Dr. Caleb Slater, here with Chris. This week we are talking about headaches.
We certainly are.
And Chris, you look like a person that gets headaches. Is that that's a weird insult, right?
You know, I had to break up with my headache.
Yeah?
There's just too much tension.
That was awful. So we just lost half the viewers because of that.
I think that was endearing, honestly.
No,
that was funny
you're wrong.
and fun.
And we're going to get some comments.
I think everybody gets headaches.
Everybody gets headaches, and so there's so many reasons for a headache. I mean, from allergies to medications to blood flow issues to posture, muscle tension to vision, stress.
Yeah.
I mean, and you could just keep going on, right?
Yeah.
There's so many different types of headaches too for that reason. We're going to kind of break it down to the spine ones because we're the spine people, right? And in that, there's actually kind of three main different headaches.
All right.
All right?
Yep.
So, and we'll see if we could label your headaches.
And I had a headache that was fairly regular for like a week or two.
Okay.
And I think I knew what it was from.
All right, well, let's see. So the three, it's upper cervical, mid cervical, and then I'm going to call it thoracic, which most people wouldn't. All right. Upper cervical, it's your COC1, C1, C2. So the upper 2-3 joints of your, so the upper joints of your neck that are right below the base of your skull.
Yeah.
This area is in charge of about 50% of you nodding or looking up, or 50% of you looking left and right. If you have a headache in this area, you typically have some pain that originates typically on one side, out of that base of the skull area, wraps around your ear, and goes to the back of your eye. This would be like your occipital neuralgia type headache. Have you heard that term?
Obviously.
Obviously, it's your occipital neuralgia term. Commonly occurs more with like motion than just static positioning. It's normally very sharp.
So does it come on quick and leave quickly, depending on
Comes
movement,
on quick,
or?
doesn't necessarily leave quick.
Okay.
Comes on quick and can be like really irritated with movement.
So would that be? Would someone categorize that sometimes as like a migraine kind of sensation if it's behind the eye?
So all headaches can get misdiagnosed as migraines.
Sure. I don't even really know what a migraine is. People just say like, oh, it's a migraine when it's a bad headache.
When it's a bad headache.
Yeah.
When it's a bad headache and the headaches last a long time and stuff like that. And then they get categorized as headaches and they get treated like that.
And I've always leaned, when I self-diagnose, I always lean into, I don't get migraines. But I think at one point I did, because of my vision going kind of blurry and unable to focus and light kind of.
Normally with a migraine, there's some visual changes, specifically like they call it an aura.
Yeah, and that's how I would probably describe it too. But before all that, I was like, I never get migraines. And then that happened, it was a little weird.
So what'd you do for it?
Just, do what I always do. Just go on living another day.
Nothing. Yeah, well, you know what? And that's what most people do.
Yeah.
And most people will take medication, right?
Yeah.
And the shitty thing is that medication really just masks your symptoms. It does nothing to explain the why. It does nothing to diagnose if it's a upper cervical, mid cervical, low cervical, if it's a migraine, if it's a cluster headache, whatever, right? Like, does nothing to explain that, just dampens your symptoms, and then hopefully eventually they go away.
Yeah, and I think, honestly, maybe half, maybe even more than half the times, they do go away, right?
Right.
So sometimes that just works.
And your body kind of gets used to these symptoms too.
Yeah.
So, or you get used to compensating. So like if looking left really far bothers me, eventually I'm going to stop looking left that far.
Yeah.
Or if I do look left,
over there for you anyways.
I hate left. If I do look left, I'm going to start to turn with my like torso, right? Or my hips, or I'm going to start to twist at different areas to compensate. So now I don't get headaches anymore, but I also don't move the same.
And the funny thing is, you probably might not even realize you're doing it at some level until someone calls out, like, why the hell do you turn like
Why are you looking like that?
Yeah, exactly.
Yeah, exactly. I can only go left. Right? So we have upper cervical headaches. Then you have mid cervical headaches. These tend not to be sided, or they could be both sides, or sometimes it's one side, sometimes it's the other. These typically feel more like they're dull. They're not as sharp. They normally happen with like prolonged positioning, prolonged sitting, stuff like that. and that a little bit more of like your tension headache, but it actually typically comes on towards the mid or later part of the day. So it's like your fatigue headache.
If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place. And we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show.
Okay.
You've been sitting there, your muscles are basically saying like, hey, we're not strong enough to do this anymore, and now you're starting to get headaches. This is more like disc-caused headaches, stuff like that.
Would it also feel like some sort of head pressure?
Head pressure.
Okay.
Yeah. But the thoracic spine, which is an area that is just strongly overlooked, that's like somebody squeezing your head.
Okay.
That's like your brain fog, fatigue, like heaviness. Yeah. Sensitivity to your eyes, because there's some autonomic nervous system issues back there too. Eye pressure.
All right. So this is all very interesting to me because I self-diagnosed my headache.
Which one of the three were you?
You know, it's a split between maybe the second and the third ones you described.
I would have thought you were the third.
And I'll just describe some of my symptoms I was having and some of my fears, I guess. So you may know, like I have glaucoma, or pre-glaucoma as they call it. I had to have eye surgery at one point to release some of the pressure. But that's like a ticking time bomb, essentially, at some point where the eye pressure will potentially go back up. So anytime I get any sort of sensation behind my eyes, I'm like, oh, well, I'm dying. My eyes are going to explode. The glaucoma's got me. But I went for like a week long where I had just a tension headache, a vice between my head, some pressure between my eyes, and I was fearing the glaucoma thing. But I thought, you know what, maybe it's allergies. So I took some allergy pills. That didn't really help. Do you know what started to help?
How long ago was this?
That was a couple weeks ago.
The foam roller.
The freaking foam roller.
Yeah, well, I told you,
you're
the third one.
I did the thing after a day or two of that.
And you never told me. You never said, hey.
I wasn't giving you the benefit of the doubt.
And nobody does. Nobody does at work. Nobody does at home.
Woe is you. But yeah.
So that's what I would have said. You're number 3, right? Yeah. And by the way, part of that, like that autonomic system and like pressure to the eyes, there's something from that. I've actually thought that some of because nobody knows why you get glaucoma, right?
Correct.
Can they explain it?
No, and it's not like maybe it is labeled a genetic thing, but no one I know in my family had it, so.
Well, and then they're just like, well, you know.
Yeah.
They just kind of push that away.
Exactly.
You know, it's a genetic thing. Well, nobody in my family had it. Well, it's a genetic thing.
It's genetic. You wouldn't know.
You're wrong.
It's technical, and you're not a.
Aunt Susie
you're
probably had it, and you didn't know.
But no, I understand what you're saying. So you're saying that part of my spine innervates something with my eyes.
It could. It can cause pressure changes. So, and it's something, I'm not sure if I actually mentioned this in my book because it sounds a little out there. So I did keep some stuff back.
Are you talking about this book?
That book. Look at that. Look at that plug. That was just natural. Where like, your spine helps pressure regulate, helps regulate your body. And one of those regulations is pressure, right? So if it's off, you have pressure dysregulation, right? So either increased or decreased pressure. Most likely it's going to be increased pressure. Mm-hmm. And we don't look at it like that. And what does a little bit of increased pressure on the brain look like? What does a little increased pressure on the eyes look like? And what does a little increased pressure on the joints or nerves look like over time, right? Yeah. And for people that have this thoracic problem, it's kind of this post-COVID, long COVID, brain fog. Now we're starting to throw other terms onto it too. But it's like this general heaviness. It almost feels like somebody's pushing down or squeezing your skull. Yep. It's fatigue, difficulty like seeing or focusing, even difficulty just focusing on tasks in general. So and that's where that like brain fog comes in.
Yep.
And it tends to be worsened with the position that you're in, specifically sitting, specifically driving. Why? Because whatever's going to that upper thoracic area the worst, that's what's going to provoke these symptoms. And it's sitting, leaning forward, and then specifically reaching. So that's why driving.
Just a combination of all that posture.
Yeah, it really just pisses that. Stuff like washing dishes, doing laundry, anything that you're looking down and you're reaching, that's going to bother these symptoms more. And you're going to notice more again, kind of like dysregulation. Your heart rate increase. You're going to notice you start to feel hot or sweating or that just feeling of unrest.
Well, it definitely caused me anxiety, but I attributed that to my fear of the glaucoma stuff too. But potentially it was all connected.
And I'm not saying it's always this.
Sure.
I'm saying that it could be this, and it's never ever looked at. You could go to 1,000 people for your symptoms. None of them would have told you that it was your upper thoracic spine.
I tend to agree. So interesting, when I had that migraine incident, I don't know, maybe it was 6 months ago, maybe more than that, I was in a position where I was at my kids' dance class, so automatically I'm just looking down at my phone, hunched over, trying to not be seen by anybody. I don't want to talk to anyone there.
Right.
Just want to be by myself. And I'm like this, and I just remember my vision going a little blurry, and then the lights getting very bloomy when I sat back up. And it took an hour or two for those symptoms to kind of alleviate. And the way they alleviated for me was I just took some ibuprofen or something like that and laid down.
And I'm not against medication. I'm against taking the medication and thinking it's curing your symptoms. That's what I'm against, right?
Yeah,
I'm also against, so if I have a headache, I'm taking medication, right? I shouldn't say that. If I have a headache that's not going away, I'm taking medication. And then I'm trying to figure out what caused the headache so I can prevent it in the future. And that's really the step that a lot of people just miss. Additionally, if you are trying to get diagnosed, if you take medication and now you go to the doctor's office or you come see me, right? Your symptoms aren't there, so it's a lot harder to tell.
Yeah.
Right? It's a lot harder to figure it out.
As a patient, that's always the worst, and I fear it every time, where I'm like, well, I feel so bad, I'm going to go to the doctor. And as soon as I step inside that doctor's office, I feel like I'm fine and I'm faking it. But the migraine thing, for me, it was a one-off thing. If it was chronic, if it came back every few days, I think I would have approached it differently. Much like I did that tension headache, where I kind of started the allergy stuff didn't work. I have an upcoming eye doctor's appointment, so that'll, I guess, whatever, we'll find out then. But in the meantime, I'm going to try these foam roller exercises, and it really did seem to help.
Well, and so what you just said right there, that needs to be distilled. That information needs to be out there, because I say this all the time.
Yeah.
If you're treating the right area with the right treatment, you see pretty significant changes fairly quickly. Yeah. Right? So let's say, because people say, well, maybe it was allergies. All right, then guess what works?
Allergy medicine.
Allergy medication, right?
Yep.
Yeah. If it was stress, guess what works?
Drinking.
Right. So the whole point is that if you're getting treatment and you're not seeing significant changes, and I try to say somewhere around 50%, somewhere around 4 to 5 weeks.
Yeah.
You know, I feel like that's a fair enough time to give most treatments for most symptoms. And if you're not seeing somewhere close to, it doesn't have to be 50. If you get to 49, you're like, fuck it, this isn't working.
Right.
No, somewhere around 50, and then you're probably not getting the right treatment. You might have even been misdiagnosed, and that's why you're not getting the right treatment.
If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
And you know what's, I think, funny? Well, maybe it's not funny, but I think what works for me in my head is I know what my lifestyle is, and I know what I tend to do a lot, which is sit at a computer, because I'm a video editor a lot of times. So I'm in a position where I need to undo that position. And
Right.
finding that the foam roller, thoracic, adjustment, whatever movement really seems to help me and alleviate a lot of the symptoms I get through my body. And maybe it's the case of, people who do a certain activity all the time, once they find that movement that really works for them, just being more consistent with it when symptoms pop up.
Yeah.
At least trying it.
Yeah, and you could do that way. You could be reactive.
Yeah.
In an ideal world, we're proactive. So
Sure.
you're waking up and you're doing some of this stuff
Sure.
right away because and you're a video editor, but there's not a lot of jobs out there right now that aren't sitting for a long period of time and looking down or forward.
And we even worsen that in our personal lives because we're just constantly on our phones.
When you're on your phone, and even when you're active, right? So let's say some activities around the house, like cooking and cleaning, right? You're still looking down. Like gardening, you're still looking down. Even a lot of workouts, you're still looking down. How many times throughout the day are your hands above your head and you're looking up?
Exactly.
It's almost never, right? And you need that movement, though. You need that muscle contraction. You need that movement in that range. You need to take pressure off of what you've been constantly putting pressure on, and you just never do. And so it's just such a simple approach, right? That it boggles my mind why we get so much pushback on it when we're like, hey, it might be your spine, and maybe just doing like 2 or 3 simple movements will fix it.
It's the same mentality though. People don't want to put the effort in. And they don't want to think that it's that simple because they would have solved it by now or they would have fixed it by now.
Yeah, and I get that. I guess I'm a very pragmatic, rational person, right? To a fault. So I don't have as much of that. I don't know. I want the problem fixed.
You are, but you also are very disciplined. You work out every day. You eat appropriate every day. You are able to do that.
Had a bunch of pizza last night.
Yeah, I know, but for the majority of the time, you are very disciplined. And a lot of people aren't. I'm not that disciplined with certain things.
Yeah, and I get it.
So it's very hard for me to get on a regimented exercise schedule, schedule that.
And that's why I just had a conversation with a patient today. I said, look, I could give you 20 exercises that are good for your problem. Yeah. But that's unrealistic to expect you to do 20. And by the way, out of those 20, there's going to be some that are better than others. Mm-hmm. So why not whittle it down to the 3 or 4 that are the best and have you work more on them, progressing them in resistance, range, intensity, reps, right? Mm-hmm. And by the way, now you only have to worry about these 3 or 4 exercises rather than giving you more. And as the more experience I get, the less and less that I give because it sets people up for success. Just even giving you those 2, right? That's still to some people a bit of a barrier. Yeah. So if you can make it as simple as possible, and if you can limit the barriers to entry, you set people up for success. Even if, in an ideal world, I could give you these 20. You did those 20. You woke up and you had your hour and 45-minute morning routine, right? But that's unrealistic. Right. Most people aren't going to do that.
So for most of these headaches that you're saying in this region of your spine, are the majority of the exercises, would you recommend the foam roller one?
To start, absolutely. And I always tell patients, because even if it's not your thoracic area, right? Your thoracic area, if it's tilted forward and stuck, which for almost all of us it is. Yeah. No matter what you do at your head and neck, you're not going to maintain the improvements because your head and neck is just constantly in this position. So I could work all day to try to get my chin back and good posture and stuff like that, right? But if what it's sitting on, the foundation, is tilted forward, it's always going to go right back.
So you got to start on that anyways.
So for I would say almost every single patient, maybe not the upper cervical ones, that and maybe a specific part of them. But for almost all these headache patients, these brain fog, these vision changes and stuff like that, that's where I start.
Yeah, and if you're just out there listening, you can find, we've done this exercise so many times on TikTok or even on YouTube as a short. You should be able to find it. Just follow us there. Question though for you about that kind of foam roller exercise. This is an exercise I think my dad had learned, or so. I don't remember where it came from a while ago. Years ago maybe at this point, but hanging your neck off the bed. Okay. Is that similar in some ways if you don't have a foam roller?
We'll say similar. Okay. But they're not equal. Okay. both of them are passive, by the way. So both of them are basically, they're creating motion, but unless you have an active muscle contraction in that range, you're not doing anything to maintain, preserve that motion, right? Hanging your head off, you're getting a little bit of a stretch, and it's mostly just a stretch. The foam roller, you're using that as a fulcrum to bend that area of your spine over. The area, like that thoracic area, there's a bunch of ribs on either side, top and bottom, plus your shoulder blades. So that area is very, very stiff and rigid. You need something to provide leverage to move it. So although laying with your head back is nice, it's going to hit mainly the cervical area, specifically the mid to upper cervical area. You're not going to get as much the low cervical, upper thoracic.
Gotcha. So then the progression on this to strengthen is what? The arms overhead?
The arms overhead,
Okay.
right? So and that's an exercise to start with, right?
Okay.
But it helps get muscle contraction in that range. Muscle contraction promotes blood flow. Blood flow is how our tissue heals. Blah blah blah, right?
Neovascular.
You love neovascular, right? But think about it too. If you wake those muscles up, and now those muscles are strong, they're able to contract in that range. Now, when you do sit forward, they're holding you a little bit better. Right? You might not be quite as far, you might be more supported, and by the way, you might sit up better, you might self-correct better.
It's funny because I remember like all you would hear about for a while was you got to strengthen your core, you got to do squats, that'll make your back as strong as possible for every day so when you're old. But I feel like with our current lifestyle, like we got to strengthen this thoracic area or like this upper area,
But
right?
you said something that I kind of laugh at in a lot of the people are like, all right, like we need to strengthen your knee, so we're going to do ankle exercises. And I'm being a little hyperbolic, but not a lot, right? Or we need to strengthen your back, so we're going to start with your knee, you know, or the glutes. And you're like, man, like, you know what works on strengthening the back? Strengthening the back, you know? We're making this way too overcomplicated. Your spine needs to move, and it needs to be strong in those ranges. Figure out, and like what you said, we primarily do this. So let's not strengthen in this direction, which for a lot of shoulder and upper back stuff, it's a lot of pushing forward. It's a lot of serratus. It's a lot of doing the exact same thing that probably got you in this position in the first place.
Right.
So why are we making this so fucking complicated?
I don't know.
If you lean forward a whole bunch, lean back a whole bunch, and then work on those muscles.
So when I was when I was having that headache, I also did the chin retraction thing, which I'm thinking that's a strengthening exercise.
Oh, it's active muscle.
Okay.
But the problem is that you're getting like no resistance. So you're not going to get any real type of strengthening.
All right. Well, I will say I did feel it in my muscles in my neck.
You a little bit. So they stretch as you're going, so you'll feel it. And again, it is active muscle guided, so you are getting a contraction. So it's not bad. But if you can find a way to get resistance through it, and there's some simple ways to do that. The head harness isn't the simple way, but it's the best way. Unfortunately, and it sucks because no matter what you do, you look and feel like a dork with a head harness on.
That's just most of the time, anyways.
Yeah. So I mean, if you're already a dork,
I think
we're great.
I think embrace your
dork.
And
so
wear the harness.
I do the head harness probably every day.
Oh, okay.
Yeah.
Really?
Yeah.
What is a way to do it without the head harness?
You do it with a TheraBand. So you can have a TheraBand that puts a little resistance, or you can go on your hands and knees, and now your head, you're fighting against gravity.
Okay.
None of those are as good as the head harness, but they're something.
Gotcha.
The hands and knees, the hands and knees, and with the TheraBand, you're still putting your shoulders rounded. So you're almost fighting against that positioning. So that's another reason I like the head harness a little bit better. But
bottom line is, though, I think it would help the majority of people out there to just get a foam roller and do that one exercise. Well,
that one, and then like what you said, arms overhead.
And the arms overhead I do throughout the day, every day, just randomly.
Yeah, so do I actually. Yeah, and every time I do it, I'm like, I feel a little bit better. Like I feel a little bit lighter, a little bit less pressure, right? And again, because no matter what you do, you're in this position.
Yeah, I remember I used to get like a lot of back pain working, and I remember one of the biggest solutions I found for avoiding just general back pain was I would just get up and walk around throughout the day more.
Movement. Yeah, movement. Well, and again, movement out of the position that you've been in, right?
I was like, oh, this makes a huge difference.
So this kind of goes to the treatment that is commonly out there for headaches, right? And maybe let's stick to the we'll call it the medical treatment, the non-physical treatment first. Okay. What do you think they are?
Pain, like just like pain medicine? Like
it's primarily medication, right?
Yeah, like.
But let's go
anti-inflammatory. Injections at some level.
There's some injections. What injections?
Cortisone injections?
No.
I don't know what else they do.
Botox.
Oh, that, okay.
They paralyze your muscles of your neck, head, and face.
Oh my gosh.
Yeah.
Just so what is the...
Takes tension off. Well, and so, like, all right, let's say the suboccipital musculature. So there's, you know the semispinalis capitis and cervices, right? Like,
who doesn't?
Love those muscles.
Yeah.
They can be pierced by the occipital nerve.
Okay.
Let's say, theoretically, they're in spasm. They're clamping down on that nerve. Now they're causing occipital neuralgia.
Okay.
Okay. So if you Botox them,
they're no longer clamping.
They're no longer clamping down. Same thing with like the upper trap. They're no longer clamping down on that nerve. Now you don't have occipital neuralgia.
So then you go about operating throughout your day with no pain, but when that wears off,
which it does,
worsen your body?
100%.
Yeah.
Yeah. I mean, do you think paralyzing your muscles is a good thing?
No.
Right. And you know what? And that should be so just direct.
Dude, I mean, like, we drink to numb away either our pain or our emotional pain a lot of times, and is that really a good solution out there?
No.
So
but
a temporary
it's fun,
numbing effect, you know what I mean? Yeah,
and it's natural.
Yeah, sure, it's organic. But you know what I'm saying? Like the metaphor, whatever the similarities there, it's like you're just numbing it.
And again, I get it. And if you have a headache and if you have bad headaches, you know what? Something that alleviates it, anything, you'll take, right? And I understand that. But it's when it gets sold to you as a cure.
Yeah.
That's where it bothers me. And a lot of times this does, right? So you get the Botox, and now you're doing this Botox once every 3 months, maybe once every 6 months, something like that. And you're paralyzing these muscles. The muscles now aren't supporting, aren't contracting, aren't working, so they're getting weaker and weaker and weaker, more inert, right? And an inert muscle doesn't contract, doesn't promote blood flow, basically dies.
So you do Botox injections every 3 months for a year or two. By the time you go to set on a real recovery process,
you're so far behind the eight ball.
So far behind.
And by the way, so like a lot of people out there would say, well, why don't they just stretch this muscle, right? Obviously, this person, the Botox isn't the first line of treatment for the most part, right? I'd say it'd be rare. Most of the time, they've tried their suboccipital stretch and their levator stretch and their upper trap stretch and their sternocleidomastoid stretch and their scalene stretch. So all these muscles around their neck.
And that's something like a standard PT would show you?
Your basic.
When you say those stretches, what do those look like to a normal person?
All right, so here's an upper trap.
Dude, when I went to a chiropractor, that's what they showed me.
And then look, here, ready? No, I'm doing.
Yeah, I would have to pull
little
back.
Sternocleidomastoid.
Pull back sometimes, reach my arm around.
Ooh, and then I'm going to do this, and I'm going to look down, and here's my suboccipital.
But the thing of it is like this stretch just does feel good.
It does feel good.
Yeah.
But if stretching worked, you'd be better by now.
Yeah, exactly.
You know, somebody actually wrote, because we said this on a TikTok, and somebody wrote something funny, and it was like brutally honest or something like that. But seriously, if stretching worked, you'd be better by now. Stretching isn't the way to help tight muscles. Okay, it sounds so counterintuitive to say that because you hear the word tight and then you think stretch.
To loosen it up.
Just loosen it up.
Yeah.
But you're not necessarily trying to loosen it up. You're trying to make that muscle pliable. Okay, so if you think about it that way, let's say I told you your muscle's tight, or I told you your muscle isn't pliable. Well, if I told you your muscle's tight, you think stretch it. Now I'm telling you your muscle isn't pliable. Now does something else kind of come to mind?
When you say that, doesn't that mean I need more blood?
Perfect.
Yeah.
You need it to
like hydrated it, whatever it might have.
Now we're, but
you know what I mean?
Blood flow.
It needs blood,
so it'd be like now you're starting to think, all right, I need to warm up. You know, if I'm like that, I need to. If I'm before an activity, I need to get some spring, some motion, right?
Yep.
So now you're thinking warm up, and that's exactly it. It's contracting. So it sounds counterintuitive, but contracting those muscles actually promotes blood flow, and that blood flow and that contraction actually makes that tissue more pliable. Now it actually might stretch on its own, or it might not be in spasm anymore. And finally, now if you do need to stretch it, now it's no longer inert, it's pliable, it has blood flow, it has some stretch to it. Now it will actually respond to stretching.
So, should I wear a neck harness if my?
Oh, love a neck harness. No.
You know what I mean?
Right? Like,
Yeah.
and again, so another type of treatment is, all right, it hurts to move it, don't move it.
Let's put it in a thing so we can't move it.
Yeah, and I'd say the neck harnesses are rarer. Traction though, traction's a big one.
Okay.
So you're in a machine or somebody is pulling on your neck to decompress.
So I need one of those tables, that inversion tables.
Yeah, so that's more lumbar traction.
Oh, okay.
I mean, obviously you're going to get some because your head's that way, but same thing. Number one, it's just temporary. It just might feel good in the moment, but it does nothing to create a lasting change. It does nothing to promote range of motion. It does nothing, absolutely nothing to promote strength. So again, just the simple shit that you need, right? We've made this too complicated. If you go to anybody for headaches, they're gonna maybe mobilize that area, but that's actually probably rare. They're gonna teach you how to stretch it. Mm-hmm. They're gonna do some isometric techniques where you're looking left and right, but you're resisting.
And you're fighting it, yeah.
They're gonna do some suboccipital stuff.
Okay.
A little chin tuck head lift. They're gonna do some postural correction, little like shoulder retractions, right? And it's not gonna work.
You know, one of the things when I was having a lot of neck pain from sitting at my desk for a while, I remember reading, oh, you need to position your monitor so it's slightly up so you're looking up like this, so your head's
Well, so
high.
in general, they recommend the monitor that you're looking slightly down.
Oh, okay.
Slightly. So the top of the monitor, I think they recommend at eye level, so that way you're looking to the
maybe
mid-screen.
I'd reverse that.
That
yeah.
being said,
Yeah.
okay, let's take it a little bit different.
Okay.
Let's say I told you that your knee should only ever be in that position.
Okay.
How do you think that's going to go for you?
It's good for now, but in 10 minutes it's going to suck.
And so what should you do?
Get it something to, I don't know.
Change position.
Oh, you mean in general? Yeah,
Yeah.
I'll change position. But if I need
Change
to keep
position.
it this way, yeah.
So and this is the stuff that gets put out to people, and then we take it too far.
Yeah.
This is where the monitor should be. No, this is a good position for it to be the majority of the time. However, guess what is good? Sometimes looking up more.
Changing, yeah.
Sometimes looking down. So
Yeah.
lower your chair, raise your chair, raise the monitor, lower the monitor, put the monitor slightly to the left. Like
Yeah.
that little stuff actually is better, right? Yes. Is there a best position if you had to maintain? Sure, but that's not a good answer.
Yeah, I'm not freaking Clockwork Oranged over here at my monitor strapped in like I should move my body.
I'm not sure how many people are getting that reference.
Yeah, we're old. People don't know what Clockwork Orange is.
It's a little obscure.
Is it?
Yeah, it's that's a cult following
I
movie.
guess, but everybody knows that scene with the eyes taped open, right?
Yeah, well, that's not the scene I think of.
No.
It's the statue scene.
Oh, okay.
Yeah.
So you like that movie?
It's been a long time since I watched it. I think I watched it as a teenager,
Okay.
so I would need to see it through adult eyes again.
You'd probably like it better. As
I'd probably like it better,
Yeah.
and that's probably why the statue scene sticks with me, because
Probably.
I was a teenager watching it, right?
Yeah.
So back to headaches.
Yeah.
Off of Clockwork Orange.
Okay.
Right? They're just not handled well. And in general, a simple approach of gaining motion in the spine, gaining muscle contraction through the range, starting with the foundation of your head and neck, which is your thoracic spine. Start there. See if that improves your symptoms. Often it's going to, especially for people that have had chronic headaches. Just the headaches, they're not responding to anything. One of the worst patients I ever had, headache-wise, she was doing quarterly Botox injections of about 20 to 30. Okay. So 20 to 30 separate injections between her head, neck, face.
Isn't that just painful in itself?
Yeah.
Jeez.
And that would incite some headaches for a little while. But I mean, again, like if you go get a flu shot, your arm hurts for a little while, right? Like,
exactly, yeah.
She was doing, don't quote me on this, I want to say monthly leg injections, and I forget what the medication was, but I don't know if I had come across a patient that was doing leg injections for headaches up until that point. She was also taking headache medication, strong headache medication that she was only allowed to take 3 times a week. So she, if she used 3 that week, that was it. She couldn't use any more. She was also using some form of Tylenol or Advil.
Was this person older?
No, this person,
Wow.
well, older like you.
Yeah, but not like
Not older like
yeah,
old.
like middle aged.
Yeah,
Yeah.
yeah. It took a few months, and this is a few years ago. We've really distilled and got this process better now, and realized what works better. Because even at that time, I think we were still doing some stretching and stuff like that. But we got her off of every single medication.
That's crazy. Just two things. One, when you said older like me, you know that I am younger than you, though.
It's like, yeah, but not not in appearance.
Oh, fair
We're
enough.
talking about appearance.
Fair enough.
Yeah.
You know what's funny, though? 40, but I've never had an injection. And I always thought that was like an older person.
No,
thing.
it's super common.
But now I'm hearing all these people, like younger than me, having
So I just talked to somebody the other day, and I wonder if she's listening to this or her sister's listening to this. But her sister was in an accident, having continued shoulder pain. The doctor isn't able to really figure out what's going on. She ended up having what's called a rhizotomy. Okay, it's a nerve ablation.
Okay.
You know what that is?
No.
So they
like, cut the nerve? Or
they
something?
cut, but most of the time it's chemically or thermally destroy the nerve.
I had one of those done, actually.
Well,
Well, sort of.
Yeah, and this is another common procedure. So like we're talking about Botox, where like it should sound wrong, right? It should sound wrong to paralyze the nerve, okay? Or sorry, muscle. Should sound wrong. It should sound wrong to destroy a nerve. And they're doing the non-motor portion of the nerve, so it's just sensory. So they basically, they know it's a nerve problem, but they can't figure out how to treat it. And again, for the most part, their treatments have been shitty. It's cortisone injections, epidurals. You go to physical therapy, they do core neutral strengthening, they do some stupid stretching exercises, they massage you a little bit, they do some taping, they've tried all their tools in their toolbox, it's not working. And now they say, all right, well fine, well we know what nerve it is, we can't fix it, the problem, so we're just gonna destroy it. And I can't tell you how many people I've met that have had that procedure done.
Sounds like just giving up.
Yeah, well, you had it.
Well, I didn't have that. I'm sorry. I had ingrown toenails, and they like killed my nerves or something around my toes, so the ingrown toenails would stop growing.
Oh.
But it was weird. 'Cause
Yeah,
they, like,
that's-
jammed in between my toes and like chemically burned something. I don't know. I was young.
Yeah, I'm not sure about that procedure for nail growth.
Yeah, I don't know. But they did something with the nerves. So
Okay.
That's why I was like, I've never had. I'm lucky. I've never gone to PT. I've never done anything for my back or like anything.
Well,
like that.
and so you're saying 40. I think a lot of people now, I have seen a lot more younger population, more and more and more. And guess why?
Because of the lifestyle of sitting at a computer.
Yeah, 100%. Because of our sedentary lifestyle and our constant positioning in one position.
Yeah.
And so it's getting more and more common that before you're out of high school, you've gone to physical therapy.
That makes so much sense because for the first 20 years of my life, I wasn't really at a computer. Well, I was like when I was a teenager here and there, but still.
It wasn't the same.
It wasn't the same. My life didn't exist on the computer.
Well, a computer wasn't even.
A real. Yeah.
No.
You dial that John up. And
I tell this to my wife all the time because it helps keep me in maybe some form of perspective. Would you know when the iPhone really came out?
Oh, God, I don't want to know this. Is it like mid-2000s?
I think it was 2007, 2008.
Jeez.
So we're talking 17 years ago. 17 years ago, nobody had an iPhone. Nobody had a computer in their hand, right?
Life was so much better.
And so we had a word processor, my family. So you know what that is? It was like basically an electric typewriter for the most part, right? I think our first computer was 2001, maybe.
That sounds about right, yeah.
Yeah.
I was, I think, middle school.
My first phone was 2002, I think. And it was one of those Nextel walkie-talkie phones.
Oh, wow. I didn't get a phone until after high school.
Well, that's college. I went to 2002.
Oh, okay. I didn't graduate high school till 2003.
Yeah.
But yeah.
But you still look older.
No, I know. It's all the stress.
Yeah. But so the point is how far we've come in that short period of time. And
Yeah.
I know we're talking about technology, but that technology has changed what we do. Like you no longer roll down a car door. or car window,
No,
right? Like these little movements throughout the day that that was making us, like what you said, your back would hurt, so you'd get up and move. These little movements that were baked into our day.
My kid in middle school has to do her homework on a computer,
Yeah,
on a laptop,
same.
on a Chromebook.
Yeah.
What happened to paper and pen? This is some old man yelling at the sky, get off my lawn kind of stuff we're talking about, but it's true.
Well, and yeah, so like that, these 17 years of these advancements have changed the way we do everything.
Yeah.
Everything, right? You don't have to go to the grocery store to get food.
No.
You lay in bed, order it. My wife did, not Amazon. What'd you deliver from today?
Whole Foods.
Whole Foods delivery.
Wow.
She didn't get her ass out of the couch today, off the couch, and she just had food delivered.
It was her birthday.
She had to carry it from the door to the refrigerator, so.
Yeah, it says the guy who didn't even do any of that.
Let's not look at it that way. I don't think let's not look behind the curtain.
Honestly, I like getting out to the grocery store and all that stuff. But.
Sure, and again, the whole point of all this is really how much we've changed in the last 20 years, where we are not baking in these little movements throughout the day, and so we are just constantly more and more static, more and more flex, more and more looking down, and I'm seeing it younger and younger, and this population is getting more headaches, brain fog, dizziness, and eye pain, all of these symptoms, fatigue, that come from your spine, come from this position, and it's not getting diagnosed as that. Or at least, and again, I'm not saying it's always, but I'm saying why not start, after you've ruled out anything that is a medical emergency, which should be the case, right?
Sure.
Rule out the medical emergencies. After that, please, just look at the spine. Look at the spine, try to do a few simple movements, give it a few weeks. If it works, great. Now you've probably addressed the actual underlying cause. And now you don't need weeks or months of failed treatment or medications for the rest of your life, right?
Yeah.
So why not try it?
Yeah, I would reiterate to check out our TikTok or our YouTube shorts and find one of those foam roller videos and get yourself a foam roller and start trying that exercise.
Love a foam roller.
Yep.
All right, that's our show. If you have any specific headache-related questions, feel free to reach out to us. info@thespinaltruth.com for email. We are on TikTok, Facebook, Instagram, YouTube. Are we anywhere else? Or Spotify. Can't reach out to us on Spotify.
Everywhere you find podcasts.
Do you want to put your phone number up? They can call you.
8675309. No one will even get that.
Well, I was going to say, you started it with a dad joke. You did a Clockwork Orange reference.
I know.
Now 8675309. I mean,
that was even old when I was a kid.
Right. Yeah, you're having an old day.
I'm an old man.
All right. That's our show. Thank you for listening, watching. Feel free to wait. Boy, I just messed that up.
Feel free to leave us a message or find us at thespinaltruth.com.
Yeah, and we're going to have a show next week, right?
Yeah, Office Killers, I think.
Oh, Office Killers.
You're
going to love that. We kind of talked a little bit about that.
Yeah, there is some other things I'd like to ask about it, but yeah.
All right.